Hello, my name is David Griffiths. I'm a GP in Oxfordshire, and I'd like to share a few concerns that I have about patient safety issues in general practice. We all care about patient safety problems, and when we're aware of them, we try hard to fix them. Unfortunately, my experience as a facilitator has shown me that we often only scratch the surface. We blame individuals when we could be looking for the root causes, the way in which our systems are setting us up to make mistakes. At NHS IQ, we have a whole range of simple techniques that help us understand the real reason why things go wrong, help us create good solutions, test them safely, and then implement them effectively. We have trained hundreds of primary care professionals to do this, but there is no doubt in my mind that these techniques are not widespread enough in primary care. Like an iceberg, the majority of safety issues in general practice lie beneath the surface, out of sight unless you really investigate. Safety incidents go unnoticed, unrecognised and unreported for a variety of reasons. Can you think of a time that you noticed a safety concern, but ultimately it wasn't resolved? Perhaps it didn't seem serious enough to warrant mentioning. Perhaps you didn't have the time. Maybe agreement on what went wrong was hard to reach. Maybe actions were suggested but never quite transpired. Maybe the problem, which seemed important at one point, slipped quietly into the depths. Change is hard, especially when everyone is busy. If you think that maybe we're making an iceberg out of an ice cube, let's look at a few stats. 30 to 50% of complaints in general practice are related to patient safety. 3 to 11% of GP prescriptions contain an error. And if you think that there are over 1 million scripts generated a day across all GP consultations, that is a huge number. And these things do matter. They create a burden on the system. A huge 5% of all hospital admissions are estimated to be caused by preventable drug events, and those come from medications prescribed in general practice. What percentage of people over 75 years old do you think suffer from harm caused by their medical management each year? 5%? 10%? Well, actually, based on notes reviews from UK general practices, it's 25%. A quarter of our elderly patients are being harmed by our errors each year. It's staggering when you think about it. Putting in place safe systems for these type of issues can seem overwhelming, and I can't deny it isn't always easy. However, NHS IQ's Safer Care workshops introduce tools and techniques which simplify the complex as much as possible, and which can be used to identify and help fix safety issues. The activities and discussions are led by GPs and other clinicians, and are grounded in everyday general practice. They're a great way to engage and involve practice staff in improving safety, which of course is a critical success factor for successfully changing the way we work. As we work in primary care, we really do understand that there are many challenges facing general practice at the moment. And you'll find a link in the description below to a short presentation that we created about them. But one of the great things about taking a bit of time to tackle your practice's safety issues is that when done well, Safer Care can actually give practice staff more time by streamlining the way work is done and also eliminating wasted time spent on avoidable safety issues. This also, by definition, gives an increase in productivity. And Safer Care is higher quality care, so improvements should be seen in other areas of the practice too. When you combine these positives, you're going to end up with happier staff and happier patients. So, if you perhaps thought that safety wasn't an issue in your practice, I hope I've inspired you to look a bit deeper, beneath the surface. If you've been feeling overwhelmed by the thought of tackling these complicated issues, I hope you feel encouraged to investigate some of the tools and techniques we use. If you want to know more, you can find out information from our website by following us on Twitter or by emailing the team directly. I hope we'll hear from you. Good luck.